So a lot of cancer care does come down to the patient being able to feel comfortable that they're doing the best they possibly can, getting the best care they can, that the right decisions are being made. Because frankly, cancer care can be difficult. There's a lot of advice. There's a lot of information on the internet, some better than others. There's a lot of well-intentioned advice from family members who care, and a lot of it's competing. So one of the things that we try to do in partnership with TMC, with this Living with Cancer Symposium, with the e-consults, is give people the confidence that they're getting multiple sources of input, that they're getting the best possible information. It is very, very difficult for the patient to be, fully versed, fully educated on all aspects of their cancer care right in the beginning. I mean, you try to download a textbook worth of information immediately in a very stressful time in life is almost too much to ask for most people. So what we try to do is provide multiple platforms that patients feel like they can get trusted advice, and give them the confidence that they're doing all the right things to try and fight their disease and live their life in the best way possible.
The thing I like about this conference is it really gives us an opportunity to connect with our patients in a very different fashion than we're able to do in that very limited time in the exam room. So this is really an opportunity to get out of the office and connect with patients and caregivers and families and really talk about the journey. And it really is a journey. Anyone who's gone through this experience knows how this disease impacts them.
Initially, it was our idea to educate the community about cancer, about what treatment options are, the science of cancer. But it turns out patients really want to learn more about survivorship and how to thrive after they're finished with their therapy.
So cancer care has become increasingly complex, but also increasingly successful. And a lot of attention now has finally turned very appropriately to talking about, let's not just help patients fight their cancer, let's help them thrive. I mean, that is the goal of cancer care, is to allow people to continue to live their life and not let it all be consumed by being a patient.
One of the values that Mayo Clinic and TMC share is a holistic approach to patients, looking at all of their needs, not just medications, not just surgery, not just certain parts of their medical care. This is particularly important with patients who have cancer. And our collaboration has enabled us to share ideas and best practices.
So I think for folks just completing cancer therapy, you're going to have challenges in the days ahead, but you will find a new normal, so to speak. And many people come out of their cancer therapy with sort of a renewed sense of hope and begin to look at their cancer. I would never say cancer is a gift, but I've had many patients say to me over the years, my experience with cancer really allowed me to kind of refocus my life. It allowed me to look at my relationships. My spiritual life has been renewed. So it can be an opportunity and a time for growth. And out of a very terrible experience, something good may actually happen.